It's a disease that claimed millions of lives all over the world. And here at home in Baltimore, we've seen our fair share of cases, ranking our city as one of the top in the country for HIV cases. With about 13,000 people here diagnosed with the virus in the city, the health department is getting creative with a program that could help turn those numbers around. It's called Protect Baltimore.
We are hoping to do this as part of the routine screening for all.
The pitch Dr. Anrata Reedy makes is anything but routine. She's asking her patients if they want to get screened for HIV.
So I think if it starts in the physician's office, they do accept to get tested.
That's the hope of the Baltimore City Health Department's new initiative, Protect Baltimore.
So we've done a lot of testing with targeted testing. Now we need to make it more generally applied to the common person.
Following new Centers for Disease Control recommendations, Acting Deputy Health Commissioner Dr. Patrick Chalk says they're trying to test anyone and everyone ages 13 to 65.
We find people who are not fitting a regular risk profile who wind up becoming HIV positive when we check into their background. So we're at a point now where the epidemic is moving around to different portions of the population, and that this availability of testing and counseling need to be part of routine health care.
I'm just here again for a follow-up visit to see how the screening is going and just to evaluate the screening process.
It's going great.
That's good to hear.
I've explained the program to a lot of my patients.
Okay.
It's Howard Abagas's job to get the doctors on board. So far, the health department worker has signed up about a dozen practices. He comes armed with the information to help them help their patients understand.
Whether they're high risk or not. We do this to help keep our patients healthy.
There are about 13,000 diagnosed cases of HIV in Baltimore, but it's estimated nationally that about 20% of the people who are infected don't know they're infected. Overall, the numbers of new infections are coming down.
You can't stick with just only what you've had in the past. You have to keep trying to catch up with the way the epidemic's changing.
Dr. Reedy says her older patients have been more willing.
You never know who your partner was with, or, so it's best to be sure to check, to look out for number one.
The past president of the Baltimore City Medical Society believes once physicians understand the program, they will support it, and everyone will benefit by stopping the spread of the disease.
Let's not live in the dark ages. Let's be real. Take the test. And, one more thing we can check off to say, I know that I'm okay.
Now, the City Health Department detailers, or people like Howard, continue to check in with their doctors for feedback to see how the Protect Baltimore is progressing. And the hope one day is to expand it. And some physicians hope to make the screening become a requirement and not just a recommendation from the CDC. Testing and treatment of HIV has come a long way since it first appeared as a deadly virus in the 1980s. Dr. Robert Gallo knows the strides that have been made firsthand because he helped discover the virus.
Well, we learned from the epidemiologists in 1981, 1982 that risk factors were having promiscuous sex, were being born of a mother, certain mothers. They didn't know it was a virus, they didn't know why, or being exposed to blood.
Now, Gallo's now at the Institute of Human Virology at the University of Maryland Medical Center, which is also partnered with the Protect Baltimore project. In his early years, Gallo worked at the National Cancer Institute. He wanted to find a cure for cancer, and his inspiration was the death of his 5-year-old sister from childhood leukemia. It was during his cancer research that Gallo was led to the discovery of the retrovirus for HIV.
But in '84, we were able to say, we got enough data. This is the cause. We have a blood test. We can protect the blood supply. We have a blood test. We can follow the epidemic for the first time.
Now, in the 30 years since the discovery, more than 30 million people across the world have died from AIDS. Drugs can slow the progression, but Gallo is working on a functional cure. Researchers in his lab have a vaccine that is headed for clinical trials this fall.